Hello, everybody. This is Olivia, Addie, and Maddie, and today we will be talking about the West Nile virus. Okay, so first of all, what is West Nile? West Nile is a virus that is acquired from an infected mosquito bite. It is the most common mosquito-borne disease in the US, and it typically occurs during the summer months when mosquitoes are most prevalent. And how it occurs and how humans contract it is first through an infected bird, and then a mosquito will bite the infected bird, and then a mosquito will go and bite a human, and that is how a human gets West Nile.
So the West Nile pathogen itself is an enveloped positive stranded ribonucleic acid virus. It's under the classification of the flaviride family. And the virus is a nucleocapsid, which is surrounded by the lipid bilayer forming the envelope. And then the glycoproteins on the envelope protrude as spikes that help in the viral attachment of the host cells. And then the growth conditions, so where it kind of grows the most is in warm and damp environments. So the replication and the life cycle of it, the exact replica for the West Nile virus is not clearly understood. However, the virus does include the DC sign and mannose receptor and several glycoaminoglycans. The virus itself enters the host cell through a receptor medicated endocytosis and then gets transported to the endocymes. And then the acidification of the endosomal compartment causes changes in the E protein, resulting in the fusion of the viral membrane with the membrane of the endosomal compartment. And then this results in the release of the viral nucleocapsid into the cytoplasm. Then the viral RNA is translated into a single polyprotein and processed. The replication is then carried out into specific domains of the viral proteins, and the viral proteins cause expansion and modification of the endoplasmic reticulum. Then the viral assembly occurs in the endoplasmic reticulum, which then buds off and then enters into the Golgi apparatus. The viral then occurs into the Golgi apparatus, where the PRM protein of the immature viron is cut off, and then the mature viral particle is released into the cytoplasm. And then it travels to the cell surface of the exocytotic vesicle and is then released from the cell through the process of exocytosis. All right, and then the mode of transmission, so it starts in the reservoir of a bird and then is transmitted to the vector, which is the mosquito, and then it can go either to humans or to horses, and it's part of the enzootic cycle. And it can be blood-to-blood transfer, so it could happen in a hospital through cells or organs that are infected with the blood, or there's also cases where it was transmitted through breastfeeding, so the baby then got West Nile virus. And the timing when it transmitted the most is through spring and autumn, and that's when mosquitoes are most prevalent.
Okay, so the clinical presentation and symptoms. So actually 8 out of 10 of people who contract this virus are asymptomatic, so about only 20% will show symptoms, and those symptoms can look like a fever, headaches, muscle aches, fatigue, vomiting and diarrhea, neck stiffness, disorientation, or swollen lymph nodes. And then there are some severe cases, but just like 1 in 150 people will have a severe case of West Nile. And in these cases, a person can develop encephalitis, which is inflammation of the brain, or they can develop meningitis, which is inflammation of the brain membranes or spinal cord, or they can develop a coma, tremors, convulsions, paralysis. Typically, West Nile is not fatal because about 2 to 3 to 5% of severe cases are fatal, but typically it is not. And how does West Nile damage the body? So of the severe cases, sometimes West Nile can have a long-term effect on the body, and typically it looks like brain damage. When encephalitis or meningitis develop, there's inflammation to the brain membrane or the spinal cord, And this hinders the brain's ability to repair damaged neurons and create new ones, which can result in memory loss, motor dysfunction, or depression, depending on what part of the brain that it damages. And another area that can be damaged is the muscles. There can be permanent muscle weakness because, like we said, one of the symptoms of West Nile is muscle weakness. And sometimes they get so weak that they cannot regain full strength ever again. And this could also be a result of the brain damage that occurs because it can attribute to the damaged motor functioning of muscles or limbs.
So the progression and timeline of West Nile obviously begins when a person is first bitten by that mosquito that's transmitted from the bird. Once the person receives that mosquito bite, they typically will begin to develop symptoms within 3 to 14 days of being bitten, and symptoms can last from weeks to months. Only 20% of people bitten will actually become infected. The rest don't show any known symptoms. And about 1 out of 150 people bitten by an infected mosquito will develop more severe symptoms that Maddie mentioned earlier, in the severe symptoms like encephalitis or coma or tremors. And so fatality actually only occurs in 3 to 15% of cases, which is relatively small compared to how it used to be.
So when it comes to diagnosis, a lot of times you'll come in and they'll ask you where you've been, so your environmental conditions, behaviors, and then what you're presenting with. To specifically diagnose West Nile virus, there'll be an antigen-specific enzyme-linked immunoabsorbent assay done, which will test for the IgM antibodies in the West Nile virus. And then on the right just shows a positive West Nile virus blood test and what those results would look like for a person that does have West Nile virus.
Next, we will be discussing the modifying conditions of West Nile virus. And these are just basically kind of similar to risk factors. They're things that if someone has these specific diseases or factors and they get West Nile, it could worsen the symptoms and make it much more difficult to recover from. So the first one is age. The older you are, just like a lot of different diseases, it's much more difficult to recover from West Nile virus due to your diminished immune system. Cancer, diabetes, and hypertension, all of these will again be affected and could cause worsened symptoms. This could be because your immune system has already been compromised by these three diseases, and having a virus will worsen it. And in hypertension, it can look like an increase in blood pressure. And then lastly is an organ transplant. And we learned that you can get West Nile virus from an organ transplant, but it's actually been found that those who contract West Nile from an organ donor will have worse symptoms than normal.
So the epidemiology, West Nile virus transmission has been reported in Europe, the Middle East, Africa, India, parts of Asia, Australia, North America, and parts of Central America and the Caribbean. These different outbreaks actually kind of took their turns. It didn't happen as a worldwide pandemic, but individually these countries or areas started to develop West Nile. So the series of outbreaks in the Mediterranean basin happened between 1950 and 1960. And in Europe and Africa, they happened between 1970 and 1980. And then America was actually first isolated with the West Nile virus in 1999, and the first case was in New York City. The racial group with the highest proportion are African Americans, Caucasians, and the indigenous populations. Severe illness can occur in people of any age. However, people over 60 years of age are at the greatest risk. People with certain medical conditions such as cancer, diabetes, hypertension, kidney disease, and people who have received organ transplants are also at greater risk. Currently, right now in the United States, as of January 10th, a total of 1,035 cases of West Nile virus disease was reported to the CDC. The picture to the right locates where those cases were most commonly found. Of these cases, 337 of them were classified as neuroinvasive disease, such as meningitis and encephalitis, whereas 298 were classified as non-neuroinvasive diseases. And then worldwide, as of 2022, when the last West Nile virus record was completed, 2,445 cases were reported in humans, and there were 165 confirmed deaths, and that was in 2021. This data shows an increase in the number of human cases reported when the last study was done in 2020, which came in at 731 cases.
So now the treatment and prevention. There is currently no specific treatment for West Nile virus. If you have a more moderate case, a lot of the time it just looks like managing your symptoms, which can be using acetaminophen or ibuprofen for those aches and fevers that often people will have. And rest is also very important, to rest your muscles and your body to recover from the virus. If encephalitis or meningitis occur, you will have to go get antibiotics to help treat it. And you also will have to do close monitoring for intracranial pressure and seizures, as those can sometimes occur with encephalitis or meningitis. As far as prevention, there's no current vaccination for West Nile virus. So a lot of the preventative measures will look like protection against mosquito bites. This can look like wearing repellents, long-sleeved shirts or pants, and limiting outdoor exposure. And then screenings for blood and organ donors are also important. If you are going to have an organ donation, it is important to identify if they have had West Nile virus as well.
So looking ahead, as Christians, we know that our bodies are meant to be temples to honor and serve Him. And as we have learned so much more about West Nile virus and how it's transmitted in the past years, there are lots of things that we previously mentioned that we can do to honor our bodies and to glorify Him, such as vector control, protective clothing, and just being aware that where we can travel can also make a difference. But we also know God is the ultimate healer, so when we turn to His word, we understand His calling. Matthew 9, verse 35 says, Jesus went through all the towns and villages, teaching in their synagogues, proclaiming the good news of the kingdom, and healing every disease and sickness. We know sickness is a result of sin and can still glorify God. So by seeking and trusting Him as nurses, we can understand Him better and just know where we should turn to. So future solutions. As of right now, there is no specific treatment for West Nile virus due to how it takes its toll on the body. Many studies have been run to attempt to create a vaccine for West Nile, but as of right now, there is no distinctive vaccine for humans. However, in the past couple of years, a West Nile vaccine has become tested on horses, which would be very huge, because if they develop something that worked on horses, then that would just become a step closer to developing a treatment plan for humans, but there is no vaccine currently available. Scientists are also investigating interferon therapy, a type of immune cell therapy, as treatment for the encephalitis, which is one of the biggest risk factors for people who develop West Nile, which would also be a big breakthrough. For reoccurrence, medical professionals don't believe there is any recurrence with West Nile virus. Like many other viruses, medical tests indicate that once a person has been infected with West Nile, he or she develops a natural immunity to future infection by the virus.